Here is a detailed and comprehensive explanation of the COVID-19 vaccine. COVID-19 vaccine. Complete drug information. 1. Generic name, drug class, drug forms, brand names, vaccine type, generic name, drug class, dosage form, brand name. mRNA vaccine, tozanamarin. Vaccine, mRNA-based, suspension for injection, Pfizer-BioNTech Comirnaty, mRNA vaccine, ilisomarin vaccine, mRNA-based, suspension for injection Moderna, viral vector vaccine, ChAdOx1S, vaccine adenoviral vector, suspension for injection AstraZeneca Vaxzevria, viral vector vaccine, Ad26.CoV2S, vaccine, adenoviral vector, suspension for injection Janssen protein subunit NVX-CoV2373, vaccine, protein subunit, suspension for injection, Novavax, Nuvaxovid. Definition: COVID-19 vaccines are biological agents developed to stimulate an immune response that protects the body against the SARS-CoV-2 virus, which causes coronavirus disease 2019, COVID-19. They work by training the immune system to recognize and combat the virus without causing illness. 3. Mechanism of action. A. mRNA vaccines, Pfizer, Moderna, contain synthetic mRNA encoding the SARS-CoV-2 spike protein. mRNA is delivered into muscle cells, which produce the spike protein. Immune system recognizes the spike protein as foreign and creates antibodies and T-cell responses. mRNA is degraded naturally and does not enter the nucleus. B. Viral vector vaccines, Janssen, AstraZeneca, use a harmless adenovirus modified to carry DNA encoding the spike protein. The body's cells make the spike protein, triggering an immune response. Cannot replicate or cause disease. C. Protein subunit vaccine, Novavax, contains purified spike protein fragments and an adjuvant to boost immune response. Does not contain genetic material or live virus. F4. Uses prevention of COVID-19 infection, reduction in severity of illness, hospitalization, and death. Used in primary immunization series, booster doses, heterologous, mix and match, boosting in some regions. 5. Indications. Active immunization against SARS-CoV-2 in individuals aged 6 months and older, depending on brand and dose strength. Adults, especially those with comorbidities or elderly. Booster doses for continued protection due to waning immunity. 6. Contraindications. Known anaphylaxis to any component of the vaccine, e.g. PEG and mRNA vaccines or polysorbate in viral vectors. Severe allergic reaction after a previous COVID-19 vaccine dose. For viral vector vaccines, history of thrombosis with thrombocytopenia syndrome, TTS. Before taking this medicine, precautions. Tell your doctor if you have history of severe allergies or anaphylaxis, current illness with fever or infection, bleeding disorders or use of anticoagulants, autoimmune conditions, e.g. lupus, RA, history of myocarditis or pericarditis, especially mRNA vaccines, received monoclonal antibody therapy or convalescent plasma recently, a weakened immune system due to HIV, cancer, or immunosuppressive drugs. 8. How to use. Given as an intramuscular injection, usually in the deltoid muscle. Administered by healthcare professionals in clinics, hospitals, or vaccination centers. No special preparation required, but stay for 15 to 30 minutes after injection for observation. 9. Dosing infant vaccine, primary series, booster. Janssen 18+, Pfizer 6 ml+, 2 doses 3 weeks apart, boosters 5+ months after second dose. Moderna 6 ml+, 2 doses 4 weeks apart, boosters 5+ months after second dose. Janssen 18+, 1 dose, boosters + months later, preferably mRNA. AstraZeneca 2 doses, 4 to 12 weeks apart, boosters after 4 to 6 months. Novavax 2 doses 3 weeks apart, booster option in some countries. Open quote, immunocompromised people may need additional doses, close quote. 10. Misdose, overdose. If you miss a scheduled dose, get it as soon as possible. No need to restart the series, even if delayed. Overdose. Overdose is extremely rare. Monitor for severe allergic reactions or side effects. Seek emergency care if overdose is suspected. 11. Stop or avoid taking if you had a severe allergic reaction to a previous dose, you have current COVID-19 infection, wait until recovered, you're advised by your doctor due to a medical condition. 12. Side effects in detail. Common, mild to moderate. Injection site, pain, redness, swelling, fever, chills, headache, fatigue, muscle and joint pain, swollen lymph nodes, nausea. Uncommon to rare, serious. Myocarditis, pericarditis, especially in males 30 years after mRNA vaccines. Anaphylaxis, life-threatening allergic reaction. Thrombosis with thrombocytopenia with adenoviral vector vaccines. Guillain-Barré syndrome, GBS. Bell's palsy. Persistent fatigue, brain fog, reported but under study. 13. Vital information. COVID-19 vaccines are safe and effective based on global data and real-world experience. Side effects are typically short-term and self-limiting. Vaccines do not alter DNA or cause infertility. Fully approved or authorized for emergency use by FDA, WHO, EMA, etc. Booster doses may be needed yearly, similar to flu vaccines. 14. Other drugs will affect some medications may affect the immune response to the vaccine. Drugs that may lower vaccine efficacy. Corticosteroids, e.g. prednisone, chemotherapy drugs, immunosuppressants, e.g. cyclosporin methotrexate, anti-rejection drugs post-transplant. Precautions with blood thinners, e.g. warfarin apixaban, risk of bleeding at injection site. Recent monoclonal antibodies for COVID-19, delay vaccine for at least 90 days. Live vaccines, follow timing guidelines for separation, generally 14 days apart. Thank you. Have a nice day.